Hello everyone, my name is Natalie and this is my patient, and today the injury that we are going to be focusing on is called the medial epicondylitis, which is also known as golfer's elbow. So I'm going to palpate 3 bony landmarks. So starting with the lateral epicondyle, you'll feel this on the lateral side, and it's kind of like an L-shaped line, and you'll feel it right here. So I'm going to draw it. All right, so right along here is where I can feel the lateral epicondyle. And then going to the olecranon process, so this is at the pointiest part of your elbow, which is right here, which points out. So let me circle that. So right here is the olecranon process. And then going into the medial epicondyle, which is on the inside, this is on the humerus, and you'll feel this sticking out, and it's like a hard ball shape. So right here is, let me feel it, right here. And right, so the brachioradialis, you can feel this when you go to shake someone's hand. So if you do this motion and you just bring your wrist up like this, you'll feel it right here. So I'm just gonna draw that, and I can actually grab it. Okay, so right here is where I can feel the brachioradialis. And then going into the biceps group, so there's 2 muscle bellies to the biceps. One tendon attaches into the labrum of the shoulder, which is the long head, and the biceps tendon will cross the elbow. So you can feel the bicep tendon when you go into a slight bicep curl. So do a slight bicep curl and just leave it right here. And right here, you'll feel a rope-like structure that comes out. So I'm just gonna mark that. So this right here is where I can feel the biceps tendon. So next, I'm going to palpate the UCL, which is the ulnar collateral ligament. So to feel this, you're gonna go and find your olecranon process and the medial epicondyle. And the structure that is in between that is where you'll find the UCL. So I'm just gonna take my thumb and just kind of feel right here. And I can feel it's like a more squishier part right in between. So from the olecranon process to the medial epicondyle is where you have your ulnar collateral ligament. So an acute form of treatment for medial epicondylitis would be to do a quick cortisone injection, which this is just a temporary fix. And then you also want to stop the motion by immobilizing it with a wrist brace. And then looking at 2 long-term treatment options. So physical therapy, occupational therapy, those are long-term treatment options, and doing some exercises like forearm pronation and supination. So this is forearm supination, and then this is forearm pronation. And then there's also eccentric wrist flexion and extension. Okay, so now moving into another location, I'm going to palpate the acromion and the clavicle, which is at the shoulder location. So your clavicle on my patient, I can see pretty clearly right here. So starting from the sternum, and I follow it up to here, where I can feel the acromion. So here's a closer look. This is the clavicle, and then right over here is the acromion where it sticks. The trapezius, I'm gonna do the upper trap. So you can see from the neck below, right in these areas, is where you'll have your upper trap muscle, and you can feel it by, you can actually pinch that upper trap muscle group right here. So this right here is the trapezius, and it actually goes down, and it's a pretty large muscle. All right, and that'll be all for today's video. Thank you for watching.